So we've heard a lot here at the meeting about the definition of high-risk disease for newly diagnosed myeloma patients. When we're thinking about high risk, we're really meaning trying to understand what we could test in a patient bone marrow sample to identify changes that would be associated with myeloma that's likely to be harder to treat, or if patients will have shorter periods of remission and therefore relapse earlier. And we're trying to define this because we want to improve our ability to give prognostic information to patients, but also moving forward to be able to change our treatment approach for patients with high-risk disease. And earlier this year, a publication came out redefining high-risk criteria in myeloma, and it's really important for us to think about how to translate that into our clinical practice, partly because it includes not only looking at changes using FISH diagnostics, but also looking at sequencing diagnostics, particularly for the TP53 gene. And it's really important that we start to follow this approach and do this more uniformly, both in the real world, in clinical practice, but also in clinical trials, because hopefully then we can start to see how outcomes for patients with high-risk disease are hopefully improving over time with lots of the novel treatment approaches that we've also been hearing a lot about at the meeting.